It's time for health tips. Now here's your host, Dr. Alma Jenkins.
Good evening. I'm Dr. Alma Jenkins, and thank you for tuning in to Health Tips. You know, it is so interesting that we are hearing so much now about depression and about stress. In fact, we've had some very depressing, if you will, episodes to happen with a couple of very well-known people that dealt with the fact that they were likely very depressed. But before we get into that, let me first welcome you to the show. And second, let me remind you that if you would like for our show to come to your organization, just let us know. Drop us a line at the station and we will be more than happy to come to your organization and to share with you some information on any medical topic that you would like. Now, you know, I am a gastroenterologist, and so that's my particular area of expertise, but if you have another area that you're interested in, we can certainly share medical information with you regarding that. So let us know, because we would love to come to you and empower you, because truly when you know more, you have more power in terms of dealing with that particular subject. Okay, so we're going to talk tonight about a subject that I think is very appropriate at this time. You know, recently we heard about the death of Anthony Bourdain, who did Parts Unknown, I think it was. He would travel around and he would cook. He would either be part of the setting that he was in, meaning that he would sample the food. He's a chef, you know, so he's done lots of cooking. And usually he's not the one cooking, he's the one tasting, he's the one sampling. He's the one being a part of the setting of the country where he has visited. And many of us got to the point where we felt like we knew him. So when I heard about his suicide, it was tough. It was really tough. And I found out that a lot of people felt the same way that I did. I felt like I was mourning for somebody that I knew. And I'd gotten to know him through his show. So, you know, and I've got something in my throat too, so I'm trying to clear it. But many of us felt that we practically knew Anthony Bourdain. And the fact that he had committed suicide, hanging no less, was very tough to swallow. But you know, that makes me want to share with you some information on depression, because many people do not realize the devastation that depression can cause. And you know, it's very difficult sometimes to read people, because most of us go along and we want everybody to think everything is great. You know, we want people to see our best all the time, and that's just human nature. We want to show our best all the time. But sometimes, deep down, there is a sadness that we're feeling. There is a darkness that may be seeming to follow us, and we need to be able to share about that. So tonight I wanted to just talk about depression. Now, many of you know what I'm talking about because many of you are depressed, or you know someone who is depressed, or you have been depressed at some point in time in your life. Now, when we talk about clinical depression, we're not talking about just being sad a day or two. You know, something happens and you're obviously and rightfully feeling down about it. And that's normal to happen for a period of time. But when it happens and stays with you to the point where you are not as functional as you need to be, you even can become non-functional, or this doesn't get better and you can feel yourself sinking in this mood, then it becomes what we call a clinical depression, and you need to get some help. Now, one of the problems with that is that depression is stigmatized. You know, if you're going to get help, some people look at that as, you know, a sign of weakness or label you. But let me encourage you to not even think about that. Think about getting better and disregard any suggestions that seeking help is somehow shameful. So without much other ado, I'm going to share with you some information that I've gotten off of WebMD, and I'm going to give them credit. This is on the computer, on WebMD. And you might wonder, well, why does she show us things that are right here on the computer? It's because even though it's there are lots of things on the computer. You may not know what thing to go look for, or you may just not have seen it. And so I saw it, I reviewed it, and I thought it was excellent. So I want to share that with you. And I hope that you will share this information with someone that you know and with someone that you think might need to know it. Okay? All right, so let's get started. We're going to review the Depression Overview Slideshow. I'm going to show you the slide, and then I'm going to share with you the information that accompanies that slide. Now, this particular slide looks at what a brain looks like in a PET scan, and many of you are familiar with PET scan. A PET scan is a way that we have of viewing something. It's an imaging study that makes use of the metabolism in the brain. And just looking at this, you see a difference in these two brains. This is a brain that's depressed, and this is a brain that's not depressed. And without getting into a lot about it, I'll just say that this scan can pick up the activity in the brain of a depressed person and a non-depressed person. So that tells us that there are some metabolistic things going on in the brain that are different when you're depressed and when you're not depressed. That alone is worth knowing. So this slide looks at depression symptoms, some emotional factors dealing with depression. This person looks like they are in deep thought. Some people drink when they're depressed, but this person is having some sort of emotional situation where they're thinking, they're contemplating, maybe worrying. The primary symptoms of depression are a sad mood and or a loss of interest in life. Activities that were once pleasurable lose their appeal. Patients may also be haunted by a sense of guilt or worthlessness, lack of hope, and recurring thoughts of death or suicide. And then there are the physical symptoms. This person has what looks like back pain. Depression is sometimes linked to physical symptoms. These include fatigue and decreased energy, insomnia, especially early morning wakening, excessive sleep, persistent aches or pains, backaches, headaches, cramps, or digestive problems that do not ease even when you get treated. Appetite may change. Changes in appetite or weight are another hallmark of depression. Some patients develop increased appetites while others lose their appetite altogether. Therefore, you might experience serious weight loss or weight gain. The impact on daily life. The impact on daily life. Without treatment, the physical and emotional turmoil brought on by depression can derail careers, hobbies, and relationships. Patients with this problem can find it difficult to concentrate and make decisions. They turn away from previously enjoyable activities, including sex. What about suicide? These are This is something we talked about earlier. As I said, there's been a rash of suicides lately. People who are depressed are more likely to attempt suicide. Warning signs include talking about death or suicide, threatening to hurt people, or engaging in aggressive or risky behavior. Anyone who appears suicidal should be taken very seriously. Do not hesitate to call one of the suicide hotlines. Let me give you the number for suicide hotline. 800-SUICIDE. Isn't that easy to remember? 800-SUICIDE. And the number would be 800-784-2433. But the short way to remember that is 800-SUICIDE and 800-273-TALK. Okay? If you have a plan to commit suicide, go to the emergency room for immediate treatment. Let me repeat that. If you have a plan to commit suicide, go to the emergency room for immediate treatment. Call this number if you absolutely refuse to go to the emergency room. If you know someone who has, let me tell you something else. Ask them what they plan to do. You know, get them talking about it and then get them some help. Okay? All right. Next slide. Who's at risk? Now, when you look at this picture, you see three people. But let me just caution you that this goes across the ethnic scale. They're not all white people who are at risk, not all blacks, not all any particular group. As you know now, we've heard of suicides across the spectrum. But gender-wise, women are twice as likely as men to become depressed. Some people believe genetics plays a part. So having a parent or sibling with depression increases your risk of developing the disorder. So that is true. What are the causes of depression? Now here in this slide, we're seeing some nerves, nerve fibers, and we're seeing the connection and the communication between nerves. Here you've got, as you know, we communicate in our brain with electrical signals, with chemical substances, and with the uptake of those chemical substances. So a lot goes on in the brain. Doctors aren't sure what causes depression, but a prominent theory is altered brain structure and chemical function. Brain circuits that regulate mood may work less efficiently during depression. Drugs that treat depression are believed to improve communication between nerve cells, making them run more normally. Experts also think that while stress can trigger depression, one must first be biologically prone to develop the disorder. Other triggers could include certain medications, alcohol or substance abuse, hormonal changes, or even the season of the year. How about seasonal changes? If your mood matches the seasons, sunny in the summer, gloomy in the winter, you may have a form of depression called seasonal affective disorder. The onset of seasonal affective disorder usually occurs in the late fall and early winter as the daylight hours grow shorter. Experts say that this disorder affects from 3 to 20% of people depending on where they live, and that's called seasonal depression. Well, how about postpartum depression? Most of us have heard of that. Postpartum depression. You know, this is the depression that some women get after they give birth. The baby blues strikes as many as 3 out of 4 new mothers, but nearly 12% develop a more intense, dark mood that lingers even as their baby thrives. This is known as postpartum depression, and the symptoms are those of major depression. A depressed mother may have trouble enjoying and bonding with her infant. What about depression in children? You know, we don't tend to think that children can get depressed. Not so. In the United States, depression affects 2% of grade school kids and about 1 in 10 teenagers. Symptoms are similar to depression in adults, but the children may appear angry or engage in risky behavior called acting out. And we've seen that. Children who've lost a parent, children who've been abused, they don't know how to express how they feel, and so they may act out. I think many of us have seen this. How do we diagnose depression? Well, that's for the physician, but I'll just say that there's no lab test for it. We doctors have to rely on the patient's description of the symptoms and just basically paying attention to what the patient is saying is how we're able to make that diagnosis, plus knowing what we do about depression. And then there are different kinds of therapy for depression. There's talk therapy. I'm not going to get into a lot about therapy. There's medication. There's exercise. I do want to say something about that because that's something we can command. Physical activity releases something called endorphins. These can affect our mood. They can help boost your mood. It leads to higher self-esteem, better sleep, less stress, and more energy. Choose something you enjoy and aim for 20 to 30 minutes 4 or 5 times a week. So you see, exercise does play a role in fighting depression. Then there's something called light therapy. I'm not going to get into these different therapies because if you go and get help, they can choose which one is for you. But since some of you are very much into alternative medicine, I will say there is a herb called St. John's wort, and it is an herbal supplement that has been the subject of intense debate. There is some evidence that it can fight mild depression, but 2 large studies have shown that it is ineffective against moderately severe major depression, and it can interact with other medications you may be taking. So talk to your doctor before taking this or any other supplement. How about pets for depression? Well, I can vouch for that. A playful puppy or a wise-mouthed parrot is no substitute for medication, but researchers say pets can ease the symptoms of mild to moderate depression in many people. Pets provide unconditional love, relieve loneliness, and give patients a sense of purpose. Studies have found that pet owners have less trouble sleeping and better overall health. Let me say this again. Studies have found that pet owners have less trouble sleeping and better overall health. I like that. I like that because, you know, those people who sort of laugh at the pet owners, you know, if you haven't owned a pet and you don't really have an appreciation for it, it can all seem a little silly. And I admit some people go really overboard with the lavishness that they do with their pets in terms of spending money. You know, now there are all kinds of lavish things you can do for your pets. And I would certainly not judge someone for what they do with their pet, because obviously if you're doing it, you must have the means to do it. But if you do own a pet, you can understand the bonding and the way that it makes you feel when your pet is doing well, or, you know, there's just so much innocence there with that pet that it brings out something in you that's a positive thing. So I can vouch for the pet thing. I think that's definitely true. What about social support? Social support is very important, and because loneliness goes hand in hand with depression, developing a social support network is very important. This might include joining a support group, finding an online support community, or making a genuine effort to see friends and family more often. Even joining a book club or taking classes at your gym can help you connect with people on a regular basis. We need to connect with people. You know, in this age of computers and gadgets, sometimes we can go a whole day without really having a conversation. So connecting is important, and as human beings, we need to connect with each other. There's that need. I would say there's an innate need that we have as human beings to actually communicate with other human beings. When we're not doing that, I would say that would exacerbate any depression that you might already have. Okay? Next slide. Now this is vagus nerve stimulation. I'm not going to say anything about that because that's a possible treatment, and that wouldn't be something that you'd have to worry about right now. You would just need to go and get help if you're depressed. Electroconvulsive therapy, that's another thing that's used. Transcranial stimulation. This is just something for you to be familiar with, not something that I think you need to look at. How about good outlook? In the midst of major depression, you may feel hopeless and helpless, but the fact is this condition is treatable. More than 80% of people get better with medication, talk therapy, or a combination of the two. And finally, that's the end of the slides. So let's just kind of sum up what we've talked about. And one of the main things I want you to take away is the number I gave you for the hotline. So I hope that you will remember that, 800, okay? Let's go back and see if I can go back. I don't know if I can go back to that slide, but hopefully we can put that at the bottom. I'm going to put that's going to show up at the bottom of the screen, the hotline number. So you can share that with your friends, and fortunately they've put it in a way that would make it easy for you to remember, okay? Very easy for you to remember. So I want you to write that down, and I want you to share that with someone who you think needs it. And I want you to, I believe it's 800 suicide. So, so if you know someone who's talking about killing themselves, or talking about the fact that maybe it would be best if they were not here. You know, when you hear people say things like that, maybe y'all would be better off without me, or, you know, maybe I don't need to be here. You know, that kind of thing, then that's what they're saying. So spend some time with that person. Make sure that you question them. Are they thinking about taking their lives? Don't be afraid to ask that question. And then get them some help. Share this number with them. Encourage them to go to the emergency room. So don't feel like I can't go because I don't have money. I can't go because I don't have insurance. Because once you go to the ER, they have to help you. They can't turn you away because you don't have money. Okay? So that's one thing you need to be aware of. Now, so what did we talk about tonight? We talked about depression and the various symptoms that you can have with depression. Symptoms that can include feeling sick, you know, bellyache. I want to draw attention to the GI or gastrointestinal problems that can come with depression, because there's this brain-gut connection that you're, you know, how people say, I feel it in my gut. There's something to that, because your gut, I would like to say, absorbs your emotional self. So if you emotionally are tied up in a knot, it's not unusual that you may have abdominal pain, you may have diarrhea, you may have constipation, you may just have crampy pain, you may get nauseous, okay? These are all things that can occur just because you're depressed. So we talked about that. Then we talked about the fact that there are various therapies. We talked about seasonal depression, where you may just feel down with the season. And the various treatments I didn't go over, because once you go to the physician, it's their responsibility to try to find out what treatment is going to work best for you. My goal today was to get you to go get help if this fits you, and to also become more aware when you're around your friends, your loved ones, and they start to show signs of major depression, that you could be their lifeline. Okay? So I hope you'll remember this. I hope that you will share this with someone. And now for the last minute and a half or so that we have, I want you to get your cans out of the kitchen. I don't have cans in here, but we can go through the motion. I want you to lift your cans. And if you're chair bound or wheelchair bound, but you can still lift your legs, I want you to do that. And if you can't, move your arms, okay? There's always something you can do. Let's go out. Up, my earring fell off. Let me get that. Let's go out on this show doing exercises. And then once you are alone by yourself the rest of the week, I want you to make a point of exercising at least 4 days a week, okay? 20 to 30 minutes. So let's just put our hands in position and let's do some pullbacks and some stretches and some going up like this. And if you have your cans, you can put your cans in your hand as you do this. And you know, it feels good. It feels good. If you do this enough times, you're going to get those arms toned up and you can just wear those sleeveless dresses and those sleeveless shirts, okay? And if you're able to stand, just stand up and march in place and lift those legs high. Lift them high and swing your arms while you're doing it. And just, you know, get that exercise going. Ladies and gentlemen, it's been such a pleasure to be with you and talk about a subject that's very dear. I'm Dr. Alma Jenkins. Good night.